Hi, I'm Dr. Tiana Seetzy at Rejuvenation MD, and today we are doing PDO threads to help lift our patient's neck. And we've already done half of it. As you can see over here, we've got multiple threads that are coming out. Don't worry, I'm going to cut those ends off. But you can see there and there. And if you were to come back, look at the front again, you can see what a nice result she's going to get just by putting some of these polydiaxanone threads right into her neck to help lift up her chin. So this is a really easy in-office procedure that we do. Takes about, well, it took us about 15 minutes on that side. So we're going to do this other side. So I'm going to show you how it's done. So I've already put some lidocaine over here. I've made a little pilot hole channel to get my thread through. Just going to wipe that off again with a little alcohol. And I'm going to just put my thread right here, and I'm going to push it on through, and then you'll let me know if you hurt. There we go. Sorry, turn a little away from me. You'll let me know if you need any lidocaine. I've attached some lidocaine here, so in case she gets uncomfortable at all, she can tell me she needs a little boost. No, I'm just traveling right underneath the skin there. And there's all different types of threads. Do a little lidocaine right there. These ones are barbed threads, so these are the best ones for lift. So I'm going to, so it's all the way in. You can kind of see where the thread is all the way down here, so it'll help lift up her marionette line. So I'm going to just push on it, twist it, and pull to get rid of that cannula. And then you'll see what a nice lift she's going to get. So we're going to continue on down, so you can see a couple others being placed. And like I said, there's a few different types of PDO threads, polydiaxanone threads. These are the barbed ones that help with lift. There are also smooth ones. So we can put the smooth ones basically anywhere there is lines, marionette lines around the lips, in foreheads. You can really put these threads anywhere. And what they'll do is they will make you make collagen right here. And the threads are made out of the same material that they use during surgery. So if you've had surgery before where the surgeon says, don't worry, don't come back, these threads are going to dissolve, that's the same type of thread we use here in aesthetics now. So we're going to go through the channel I just made, right along her jawline. You okay? And go down. Easy. Go as far as possible there. Twist and shout here. Easy. So the second one's done, and that's going to be a nice lift. And she's going to get an immediate lift, but then also over the next 3 months, her body is going to make collagen right around these threads. So it'll be nice for collagen stimulation, and it'll keep her neck in a more upright position. So we like our necks to be upright, right? Okay, the next one, can you feel that? So we're going to just do our little pilot channel. We can give ourselves a little head start. And so there's also threads that have twists on them. They do a little bit more lift. We do twists a lot around the lips to do a lip flip. So you can use these. You don't have to figure out what kind of thread you need. I'll figure out what kind of thread you need when you come in, and you tell me what your goals are. So, I've also done a lot of threads in the breasts, and I've combined them with PRP for the breast lift, the vampire breast lift, if you guys have heard of that. I've combined the threads so that way we can also pull up at the same time the PRP is working to stimulate restructuring. The threads are lifting right away. So people have really liked the combination. All right. You can also put these threads around the elbows to lift the elbows, to lift the knees. Anywhere you need lifting, these threads can go. And they will dissolve over about 6 months. However, the collagen that you make stays on for 1 to 2 years. So, let's see here. We're there. We're going to go a little lower. Are you okay here? Got a great patient here for our demonstration. I love that. And we're gonna go. Is this hurting you at all?
No.
Excellent. I didn't tell her to say that. Okay, next one. Well, hopefully we didn't just jinx ourselves, right? All right, all the way down. And let me know if you need that lidocaine. Push it all the way across. All right. Like that. That's excellent. And we've got one more to put in. That way you can see a full neck, and I can show you what it looks like when we pull up here. But as you can tell, it's a really simple in-office procedure. Right there. Okay. How's that? Can you feel that?
No.
And make our channel. The other thing that's nice is because these threads are on a cannula that is a blunt tip, there's no needle at the end of this. As I glide through our patient's skin, I'm irritating a bunch of cells. And as I irritate them, they kick into fight or flight mode. Well, they can't go anywhere because they're stuck in your skin. So just simply the process of putting the threads in will make you make collagen. And you know, they look purple. They are purple in color, but you know, you don't see them on her skin at all. They are completely underneath. So what I'm going to do next is I'm going to pull up and just massage up just to initiate those barbs. And you can see what a nice result we get right now. Lots of times with the neck though, you do get some swelling. So she may not see as much result today as she's going to see in a couple more days after her swelling is gone. And those threads are nice and deployed in there. But these you can combine with other laser treatments. We were talking about halo laser treatments, BBL laser light treatments. So you can combine these. They're not mutually exclusive by any means. And I always tell people, it's like going to the gym. What's the best exercise? They're all good. They all work differently though. The elliptical works differently than swimming, that works differently than weights, but they all work better to improve the health of your body. Same thing with what we do at Rejuvenation MD. We do threads to help lift, we do BBLs to help with your skin health, we do halo to help with wrinkles. So they all work well to improve the health of your skin and make your skin look better. So I don't know if you can see, I've only deployed this side, but compared to this other side, you may be able to see a difference. I'm going to grab a quick scissor real quick to cut off the ends. And actually, right up here, sorry about that. Last minute decision to take a video, so I'm gonna come back and you can see how easy it is just to have those little threads disappear underneath her skin after I cut off the ends. And then you know what? No one's the wiser. So she can go back to work. Nobody will know what she's done. Well, except all of you and anybody that watches the video. But this little arnica will just make sure that, like that. And we're going to just get rid of this end. So we're going to pull it a little bit farther. And there we go. We're going to just take that arnica gel and just rub again. And now I'm slippery with arnica gel, of course. And all of these are just going to disappear underneath her skin. And then over the next couple months, she's going to make collagen in response to these. And she'll be very happy. It was quick and easy. I think we started this about 15 minutes ago. You can see whatever the timing says on the video, right? And you'll know how long it takes to put 5 of these barbs in each side. And I'll have her try to sleep on her back for a few nights. If she doesn't, it'll be okay. It's not going to be the end of the world. And she may feel a little clicking because the barbs sometimes grab, and that's all normal. But you can tell that there's really no evidence that anything has happened here. Bruise wise, all of those are nice and little channels where we went and entered. I'll be covered up with hair very easily. But again, I've only instigated those first 5 on this side, so you can see what a difference has already made compared to the other side. So I don't want to bore you guys with cutting off the ends on the other side, but if you have any questions, please email me or go to our website at rejuvenationmdmedspa.com.